I'm going to talk about horses that rotate and what that's all about and how it differs from those who are sinkers. And we'll also talk some about the modern day Laminitis event of equine metabolic syndrome, which has been in the past classified as Cushing's or Cushing syndrome. But first of all, let's look at the graphics here. I want to show you a little bit about what's really going on here. You'll see that there's an inflammation in the front part of the hoof that surrounds the side here. And if you look, this is what I'm going to describe to you is the horses that are rotating. And basically speaking, the lamina in the front part of the foot, from about here around to the other side, are the lamina that are affected. And it's basically in the front portion of the coffin bone. The back part is generally not as affected as much or not affected at all, and depending on the severity of the situation. But if you look at this graphics, you'll see that the coffin bone actually separates from the wall in front by the lamina and moves downward in the tip of the coffin bone actually heads towards the ground, pushing the sole down as well. And it compromises the circumflex artery and vein. In some of the past anatomy sessions that we've had, we talked about the circumflex artery and vein, and they're basically right in this region of the foot here. They're below the tip of the coffin bone, and they supply all of this bottom end of the bone with its nutrients. Well, in the cases of laminitis, and particularly when the horse rotates, it pushes down on that artery here and actually crushes it and shuts down on that blood supply. So it becomes a very complicated situation with horses that are rotating. And if you look at how a horse stands, and this is how you can tell whether a horse is rotating or sinking. As a rule, they'll stand in a camped out position with their heels on the ground and the front part of their foot tipped forward in this sort of a position here. The limb out and the toe is tipped down, and two things are happening here. The back part of the foot is usually less painful, certainly a lot less painful than this portion over the front part. So they're seeking out the best part of their foot for support. They can get up, they can get down much more easily than they can if they're a sinker, because in a sinker the rest of the foot is affected more. So horses that rotate will seek this position for comfort, and also it releases some of the tension on the deep flexor tendon, which actually pulls on that bone, and it seems to pull it right down into the sole. Now, it seems as though it's an involuntary pain response, involuntary tension on that deep flexor tendon that causes that to happen. And so it's just the position that they seek to make themselves more comfortable. Okay, we're going to talk a little bit about those horses that are sinkers. Now the difference is with the two types is that the lamina in the whole upper portion of this foot is affected. Instead of stopping here, the pain, the inflammation goes clear to the back. This is the most catastrophic event that can happen as far as laminitis is concerned, because as you would imagine, the whole coffin bone then moves straight down. It doesn't just move in a rotated form, being the tip of the bone down, but the whole coffin bone assembly moves down in the bottom of the foot. If you look here, you'll see that the lamina around the coronary band, as well as that down the front of the hoof wall inside, and also along the sole. And as the horse bears weight on that foot, that just tears the lamina loose, and the coffin bone just settles straight down. And horses find a different stance in this particular disease because the front part is generally more affected, but it will separate at a slightly earlier rate than the back. They lose sensation earlier in the front portion, and oftentimes they're more painful in the back part of the foot, which is different than those horses that are rotating. So their stance is slightly different. You'll see them standing straight down with with the front legs. Quite often they'll stand underneath of themselves behind, or they'll stand with their legs behind them. If the pain in the back part of their foot is where most of the pain is at, then that's how they'll stand, to try to lift the heels up a bit to get rid of some of that excruciating pain. Unfortunately, horses that are sinkers are the most severe, and what happens is the hoof capsule just merely slides right up over the top of the coffin bone, and it happens all the way around, crushing the bottom of the foot, all of the vasculature and all of the corium to the sole. Everything on the bottom gets compromised as well. So there's a lot of stuff that's going on there that's very difficult to deal with.